Good afternoon, ladies and gentlemen. For our presentation, we are going to be talking about gatherings. We will look at the overall timeline of COVID and how specific countries implemented lockdowns and restricted gatherings.
We'll stop all gatherings of more than 2 people in public, excluding people you live with. And we'll stop all social events, including weddings, baptisms, and other ceremonies, but excluding funerals. Parks will remain open for exercise, but gatherings will be dispersed.
So how do we define mass gathering? According to the WHO, mass gatherings are events that can place a large strain on the health system. These can include large gatherings like sporting events or even smaller gatherings. It all depends on the location of these events and how it affects the healthcare system of that location. The CDC can also have its own definition for mass gatherings, which is very similar to the WHO. It considers a mass gathering an event that could strain the resources of the community that it takes place in. This can be anything from conferences to weddings and can be planned by individuals or organizations.
As of February 21st, 41 cases and 1 death had been reported in the WHO European region. The WHO began to publicize key considerations for handling COVID-19 earlier in the month when cases started to spread outside of the original epicenter, Wuhan, China. Key considerations included the importance that event organizers should agree with public health authorities on how participants and the local population will be kept informed about the current health situation. Warnings were produced early on of the importance and coordination between local and national public health authorities, yet there was a common theme of reluctance to adhere to social guidelines in the early stages of the pandemic. On February 27, 2020, France's health minister, Olivier Véran, addressed the public by stating, "There's no scientific or medical argument at the moment to justify calling off any large gatherings." This exemplifies the uncertainty surrounding the virus when it was just coming to the forefront in Europe. Decentralized healthcare systems and a lack of interstate cooperation within the European Union served to prolong the effects of the first wave.
Despite being ordered to stay inside, some were confidently defiant.
We are completely in a good athletic forms, and we think that is not a problem for us.
Across Europe, resorts, schools, and even borders are being closed, but some aren't heeding the warnings. Video of this crowd at a bar in Dublin infuriated Ireland's health minister, who said it was an insult to healthcare workers.
Pictured on the left is the Louvre. On March 15th, former French Prime Minister Edouard Philippe announced the closure of shops, restaurants, and banned large gatherings. Restrictions on gatherings began to become implemented across Europe as lessons were learned from Italy's northern regions of Lombardy and Veneto in particular. France and Germany banned large gatherings of over 1,000 people after only suffering from a fraction of the same deaths in Italy. Among many other European nations, Poland, Czech Republic, Romania, and Slovenia also banned events and large gatherings during the early stages of the pandemic.
Here is an overview of the events in the EU between March and June, focused mainly on lockdowns and gatherings. COVID-19 was declared a pandemic on March 11th, but one day before that, Italy was the first European nation to go into lockdown. Shortly after, other countries followed and events and games were canceled. In April, more events were canceled, like Wimbledon, the running of the Bulls, and Oktoberfest. However, some lockdown measures were eased. May is when lockdown measures really began to ease. Most of the EU countries began to open back up with social distancing guidelines and mask requirements. However, there is still a strict limit for gatherings. In June, we began to see travel resume and monuments and museums open back up. Larger gatherings are allowed, but mask mandates are still in place for many countries. This easing of guidelines during the summer has led to a resurgence of cases in August and September, creating worries about a second wave.
As seen on the previous slide, gatherings are one of the biggest causes of COVID spread, and many EU countries impose nationwide lockdowns to prevent large gatherings. Many countries, like Italy and Spain, imposed very strict lockdowns in March and continued them into May. Others had limited lockdowns and reopened more quickly. The results of the lockdowns and limits on gathering resulted in different outcomes. Instead of acting together as a unified Europe, countries took matters into their own hands and turned their back towards countries that needed help. The combination of a disunified EU and relaxed regulations has resulted in Europe progressing towards a possible second wave. We'll take a look at some individual countries later. So what does the data look like? In the beginning, you see a figure, which is a general timeline of concrete actions taken by different countries' governments in response to the initial case in each country. While not all of the countries in this figure are in the EU, it gives us a general pattern as to which countries responded first and which policies were not as stringent. The purple highlighted countries were 4 out of the 6 that we chose to focus our research on. All of the countries highlighted except France waited until they hit about 600 plus cases to institute limitations on gatherings. This is more likely than not a contributing factor to the rise in those countries' case numbers.
The following slides will each have 2 graphs, one measuring mobility over time in the country in question, and the other measuring that country's COVID cases in the same time frame. Mobility refers to how much people are moving around as compared to how they would normally outside of social distancing and lockdown measures. So a 0% measure means that people are moving around just as much as they normally would, going to restaurants, concerts, etc. As we will see in the following graphs, numbers of COVID cases in multiple countries have gone down when mobility decreases. Often this leads to a loosening of restrictions, which has contributed to the second wave many countries are currently experiencing. Because symptoms can take as many as 14 days to appear, there is often a delay between contracting the virus and testing positive or reporting that test. Therefore, it makes sense for a decrease in cases to lag behind a decrease in mobility.
So the first country that we chose to highlight was Belgium. Belgium's initial social gathering policy hinged on, quote, not putting anxiety on top of anxiety. So they chose to take a little bit of a less stringent measure at the very beginning. Then we see a severe spike in cases that put the country in lockdown, but gatherings of a max of 10 people were approved in late April after cases started to go down.
As we can see in the bottom graph, their curve was pretty hectic, and they had a bit of a peak right there in April. And so that was kind of around 0.02% of the population. And we're going to move through a couple of other countries and just compare that with their initial peaks as well. So then in France, French officials were serious about a lockdown requiring citizens who needed to leave their homes for reasons considered essential to carry a lockdown pass, which explained their reason for leaving. And that's pictured here on the right, but it's in French, so we can't read it. But one article points out that due to the way the French Constitution is written, the French government can restrict gathering in public places, but not in private locations. And so that made it a little bit more difficult for them to be able to have a stricter lockdown. And then conflicting and complex policies plague the population as the new wave threatens the summer's equilibrium.
While the city of Madrid is currently in a state of emergency, it's less severe than the March lockdown, which prohibited any kind of meeting at friends' houses and canceled Holy Week processions in Seville. On the top graph, we can see how mobility initially plummeted in Spain, but the curve of cases confirmed doesn't appear much different than other countries. This calls into question the effectiveness of the strict measures that Spain saw.
Then we have the United Kingdom, and their curve for mobility looks a lot like Spain's, where it just plummets. Their lockdown was initiated in late March, and as we saw in the opening video of Boris Johnson addressing the United Kingdom, people were expected and required to stay at home. There would be police enforcing rules by imposing fines on those who did not abide by regulations and dispersing groups that were gathered in public places. Despite having a less severe lockdown than other countries like Italy and Spain, their curve looked similar or even less severe than other countries. The United Kingdom also has differing levels of restrictions across the different nations of Scotland, Wales, England, and Northern Ireland. Lastly, for the country comparisons, we have Sweden. And Sweden is somewhat of the poster child for relaxed rules. They never issued a nationwide lockdown, but rather they issued a series of recommendations in the hopes that Swedes would follow without it being a mandate. And they only banned gatherings of 50 plus people. Other than that, life was pretty normal.
When we look at the countries across a policy spectrum, you have Sweden, the poster child for the quote-unquote herd immunity approach, in which there are few distancing measures and no strict gathering restrictions. So you have Sweden on the left, and then you have Italy all the way on the right, which instituted a total lockdown almost immediately after their cases skyrocketed. Across that timeline, you also have Belgium and then France, then the UK, and then Spain, which had around the same restrictions in place. We placed the EU more towards the herd immunity approach only because there was no real unified EU response when it came to gatherings, only general advice, and there was no law instituted in terms of gatherings. We directly related that to deaths per capita as of October 16th, 2020, to kind of observe the effectiveness of these efforts. You'll see as you go across the timeline that Sweden had a relatively lower death per 100,000 people at 57.7. But once you get into the countries that had slightly less strict measures, but had other factors affecting their public health directive compliance, you come across Belgium, which is a 90.15 per 100,000 people death rate, which is one of the highest in the EU. You then come to France, which is 49.3 per 100,000. You then come to the UK, which is 64.96, Spain, which is 71.49, and Italy, which is 60.26, which is a dramatic improvement from the rough start that they had at the beginning of the year.
So models and estimates by professors of epidemiology at Imperial College of London, which is who created this graph or this little graphic, estimated at the end of March, after only a few weeks of social distancing and lockdowns, up to 120,000 potential COVID deaths had already been prevented up to that point due to social distancing, lockdown measures, and gathering restrictions. While it's easy to suppose that restrictions may not have worked as well as intended, this study points out that it could have been much worse.
At the beginning of the pandemic, we saw that Italy and Spain suffered the worst first wave outbreaks. Two Southern European countries that are known for more social culture, more outdoor terraces, kissing of the cheek as a tradition. This can be seen as a reason why it spread at first before there was actually any restrictions set into place.
Other factors that influenced gathering restriction was government authority. So we mentioned earlier that France only had the authority to police public spaces. So when it came to private spaces, gathering restrictions were much more lax, and that privatization could have contributed to a higher level of deaths per capita in France. So when it comes to government trust, there were four areas that we looked at: implementation, compliance, risk perception, and mortality. And then there's a little bit of this graph or this figure that highlights consequences of trust. But really what we looked at was the implementation. They found that higher societal and political trust is associated with later adoption of restrictive policies. And so this applied to the European countries and kind of explains the role of trust in relation to compliance with public health directives.
As we see here, people in Northern and Western European countries naturally tend to keep further apart, which is demonstrated by longer preferred interpersonal distance, while those in Southern and Eastern European countries are comfortable being closer. This means that it may be easier for those in Switzerland or Norway to follow social distancing guidelines than for people in Austria or Bulgaria. These countries tended to have stricter lockdowns, which may have overcome that higher likelihood of close contact.
Because of the relaxation of rules during the summer, Europe faces the possibility of a second wave. So countries are taking steps towards preventing that. France is issuing nighttime curfews and banning receptions, student parties. Italy has a max of 30 people with limits of 20 people at parties. And the UK has the rule of 6 with a max of 15 at weddings, 30 at funerals, and no more than 5 at restaurants.
So when we look at a potential second wave in Europe, this map illustrates the gathering restrictions around Europe as of October 2020. The nations colored dark red do not allow more than 10 people in social gatherings, while other countries have already begun to allow more than 1,000 people at gatherings. However, numbers vary between outdoor and indoor gatherings. One important thing to note when looking at this graph is that the nations that experienced the worst first wave outbreaks, such as Italy, Spain, and the UK, are having to continue stringent gathering restrictions. On the left, we see the Gran Via Street in Madrid. Now, Spanish cities and Madrid in particular have gone back to strict gathering measures where family and social gatherings are limited to 6 people. On the right, we see the Galerie Royale de Saint-Hubert in Brussels, Belgium. Belgium, on the other hand, is beginning to allow some gatherings for sporting events. However, a maximum of 4 people can gather around the table in a bar. In Italy, social distancing and the wearing a face mask is now required in all museums and galleries. However, in Sweden, masks are not required, and the government has banned gatherings of more than 50 people, but shops, bars, restaurants, and gyms have still stayed open.
In conclusion, there was no coordinated EU response in response to social gatherings. They left those different policies up to the states. And because they were different for every state, this resulted in interstate travel complications. The fact that these rules were constantly changing did not help anything, and it exposed the shabby framework when confronting this pandemic. Different sociocultural factors led to different policy outcomes in these different countries, which meant that more stringent measures did not necessarily lead to fewer deaths. And finally, the second wave of the virus is now coming across Europe. And so it will be interesting to see how these new measures are confronted and executed in each country.